screen?
Yeah, it's visible. It's absolutely fine.
Okay. So I remember maybe 6 years back, I gave this presentation as a thesis protocol in RP Center, and everybody thought it's that I required psychiatry referral. So it has been a long, arduous journey to bring this into mainstream ophthalmology. And I have no financial disclosure, but this is one of the books I read as an undergraduate. This is from a European explorer who came to India to investigate this business of meditation. And since you have a lot of time during the lockdown, I would recommend this book you should read, The Quest of the Overself by Paul Brunton. This is on why and how to do meditation, what is the benefit. So coming to the yoga, yoga is a ancient technique. Nearly 5,000 years ago, it was standardized by Maharishi Patanjali. It is a science to cultivate holistic health, physical, mental, social, emotional, and to attain a state of higher consciousness. Now, I just want to make it clear that yoga involves physical postures, breathing exercises, and meditation. So what I'm going to, the lecture for today, we are not concerned with any physical exercises. You have seen that some asanas like Shirsasana may be harmful. But the main benefits of yoga for glaucoma patients come from the breathing exercise or the pranayama and meditation. And that is what we are concerned with in this lecture. Now, meditation is a technique. Basically, you're trying to focus your attention either on your breath or on a mantra or any sound. And the second form of meditation is called open monitoring, where you just observe your thoughts. The basic purpose of meditation is to induce a state of relaxation, and that leads to a state of calmness and equanimity. In terms of modern physiology, meditation leads to what is known as the relaxation response. This is a physiological response driven by the parasympathetic nervous system, which counters the stress response driven by the sympathetic nervous system. So basically, when you're doing meditation, you are initiating the relaxation response, which has got numerous positive effects on the human body. Now, you're all aware that if you have stress, you get high blood pressure, you get systemic hypertension. But what I want to emphasize is the new thing we have found is that like increased stress leads to systemic hypertension. Similarly, increase in stress can also lead to ocular hypertension or rise in the intraocular pressure. This is the concept that I want you to understand. And why is this important? Now, any glaucoma patient who walks into your OPD, you ask the patient a leading question: do you take any form of steroids? Because steroids lead to rise in intraocular pressure. But perhaps what you should also be asking the patient is, does he have any psychosocial or emotional stressor in the recent past, or is he under some chronic stress? Because increase in stress raises the endogenous cortisol in the body, and that leads to an increase in intraocular pressure. Because patients of glaucoma are already high steroid responders, and if you have a rise in endogenous cortisol, that can significantly increase the intraocular pressure. So not only do we ask for exogenous steroids, your endogenous cortisol, if high, can raise your intraocular pressure. It can be a causative factor and even worsen your glaucoma. The second important concept I want to discuss is about the effect of glaucoma on the human brain. Now, you have heard numerous lectures on glaucoma, and you have had this list of all the factors that are implicated in glaucoma. What we treat is the intraocular pressure, but like what you heard from Dr. Sirisha, you can have ischemia, autonomic dysfunction, you can have oxidative injury, glutamate excitotoxicity, and you can have decrease in neurotrophins to the brain, increased inflammation, and nitric oxide dysfunction. Now, we have heard all these elements which cause the glaucoma or RGC apoptosis, but we can do nothing about them. So this is all in the theoretical domain. for us, nothing we can do about it till now. And recently it has been shown with MRI imaging that glaucoma, there is a transsynaptic degeneration affecting the occipital cortex and the lateral geniculate body. So you have brain changes occurring in glaucoma patient. That is why the new concept is that the brain is the potential diagnostic and therapeutic target for glaucoma, and that is what we are going to discuss. Now, what is the relationship between stress and brain degeneration? Whenever you have increased stress, that raises the serum cortisol. The cortisol goes and damages the hippocampal neurons, and the hippocampus is responsible for memory. So if you have rise in cortisol, you have destruction of the hippocampal neurons, which leads to a loss of memory and dementia. And this may be one of the reasons why glaucoma patients are often reported to have poor compliance and adherence. These are very famous studies done on aging, the MacArthur studies, and what they found was that the cognitive decline, the degeneration in the brain is directly associated with increased levels of cortisol. But the good news is that you can reverse the degeneration if you lower the levels of cortisol. As you heard from Ronnie, that glaucoma directly impacts the quality of life. So our glaucoma patients have a poor quality of life. They have high levels of dementia, anxiety, depression. And furthermore, what we reported was once you start therapy, because of the drug side effects, the quality of life worsens. And we are not doing anything regarding the quality of life till now. And the next concept is what is the impact of meditation on the human brain? In the last decade, there has been a lot of research on this, especially from the United States of America, because they are working on longevity. And this is the thing that is important to understand, that meditation can actually reverse neurocognitive decline. And MRI imaging has shown evidence of neurogenesis in the adult brain with meditation. This is the first study done from the Harvard Medical School. The first author was Sarah Lazar, in which they reported that meditation was associated with an increase in the gray matter thickness. You can see in the graph, this is the normal decay in the gray matter over age, and this straight line is meditators, and they found that meditation offsets age-related cortical thinning, and this was even reported from the occipital cortex. And this is a meta-analysis from 21 neuroimaging studies, and the gist was that meditation experiences was associated with the increased synthesis of both gray matter and white matter in the brain. Now, these are cross-sectional studies, so there was some limitation to these studies. So this second study from the Harvard Medical School, this is a longitudinal 8-week study in meditation naive patients. And what they showed, even with 8 weeks of meditation, there is an increase in the volume of the gray matter. Similarly, with meditation, increase in the white matter density in the brain has been reported. And this is due to increase in myelination and axon density. So there is a structural increase in both the white matter and the gray matter of the brain. And this is a very interesting study. They have calculated what is known as the brain age index using artificial intelligence. And what they found was that the brain of meditators was 7.5 years younger than control. So what they concluded was that meditation is useful for preservation of the brain, and it definitely protects against age-related cortical atrophy. And this is what is actually neuroprotection, that what we have been looking for. So meditation can confer a neuroprotective property to the human brain. Now, what about the cerebral blood flow? So it has been well documented that patients of glaucoma have a decrease in both the ocular blood flow as well as the cerebral blood flow with MR angiography imaging studies. And there is also reduction in the cerebral blood flow to the visual cortex, which is directly correlated with the visual field and the retinal nerve fiber layer damage. So the question is, we know blood flow is reduced, but can we do anything about it? So this is the study done with meditation using the single photon emission computed tomography. And what they showed was that with meditation, there is an increased blood flow to the brain, which is well documented. And this is our study done with the Department of Physiology in AIMS. And this is a new technique in which we can study the oxygenation of the brain using functional layer infrared spectroscopy. And what we found was that with a 6 weeks trial of meditation, there is an increase in oxygenation of the brain, which is very significant for glaucoma patients. And this is a recent machine that is there in our Department of Psychiatry, where they're measuring the oxygenation of the occipital cortex. So what we found was that glaucoma patients who underwent meditation, there is an increase in oxygenation of the visual cortex, and that can be very helpful for glaucoma patient. Now coming to normal pressure glaucoma, I have a number of patients coming to my OPD, even doctors, who have IOP 10 to 15, and they continue to progress with visual field damage. And that is because of they have an autonomic dysfunction, and that is what the cause for normal tension glaucoma. Now, it has been very widely reported that patients with normal tension glaucoma have an autonomic dysfunction. They have an increased sympathetic activity and a decrease in the parasympathetic activity. And this is because they have, how do you measure the autonomic dysfunction? You measure what is known as the heart rate variability. So better the heart rate variability, better is your autonomic dysfunction. But what was found was that patients on normal tension glaucoma have a disturbance in autonomic dysfunction with a predominance of sympathetic activity. And this leads to vasoconstriction and ischemia that causes the visual field damage in normal pressure glaucoma. And you can see that the visual field progression was directly correlated with the autonomic dysfunction. So higher the autonomic dysfunction, faster is the visual field progression. And this is an important concept to understand. Now, can we do anything about it? So this is the new concept emerging in science, the brain over body, that is the willful regulation of autonomic dysfunction. And you can see from this study on the effect of 5 days meditation on the autonomic nervous system. Even just with 20 minutes for 5 days, there is increase in parasympathetic activity and a decrease in sympathetic activity, leading to a better regulation of the autonomic nervous system by the frontal cortex. So with meditation, you can directly regulate the autonomic dysfunction and improve the blood flow. And patients of glaucoma often have associated diabetes, hypertension, cardiac illness. And what has been found is that with meditation, you can improve the other diseases also. So this is the statement from the American Heart Association, where they have reported that meditation is an adjunct to standard guided therapy for cardiovascular risk reduction. And this is the editor's pick from the journal Circulation. And what they reported was that with meditation, there was a 48% risk reduction in mortality. So in addition to the ocular benefits, if glaucoma patients have associated cardiac illness or other diseases, they can definitely benefit from meditation. And it is useful for a variety of psychiatric and physical disorders, in addition to the benefits for ophthalmology. Now, question is often asked that why do we do meditation focused on the breath? And this is a very important concept to understand. When you do slow breathing from the nose, less than 6 breaths per minute, the nasal mucosa is very highly innervated. So you directly stimulate the nasal receptors, which modulate the olfactory bulb activity. And this in turn modulates the brainstem and the cortical function. So if you reduce your breathing to less than 6 breaths per minute, you can directly modulate the function of the autonomic nervous system and the cortex. So this is a very important concept recently reported in Scientific American, that proper breathing brings better health. Now, a number of patients are not able to meditate because they just can't concentrate. So a simple take-home message is you ask them to do 3-6-5 breathing. That means 3 times in the day, reduce your breathing rate to less than 6 breaths per minute for 5 minutes. And this leads to activation of the parasympathetic nervous system and creates a relaxation response, which is helpful. Now, putting all these factors together, we did the first randomized controlled trial on the effect of meditation in glaucoma patients. And we found that 75% of patients had a 25% or more reduction in the intraocular pressure. There was a significant improvement in the quality of the life of the patients. And you can see significant reduction in cortisol, interleukin 6, tumor necrosis factor, and the reactive oxygen species increased, the antioxidant capacity increased, and there were significant changes in the gene expression. So meditation was very helpful for lowering IOP and improving quality of life, reducing cortisol. Now, how come meditation reduces intraocular pressure to such a significant extent? You have parasympathetic activation, you have a central regulation, decreased cortisol, but two important mechanisms. One is with meditation, you are increasing plasma melatonin. And plasma melatonin has a direct impact on the intraocular pressure. You have a significant reduction in intraocular pressure reported with analogs of melatonin used in the treatment of psychiatric disorders. The other thing is you have a direct stimulation of the hypothalamus, which regulates and lowers the intraocular pressure. And finally, what we reported last year at ARVO, that can meditation directly impact the ocular tissue? We did the gene expression of the trabecular meshworks taken from patients who did meditation and then were subject to trabectectomy. And what we found was that in meditators, there is upregulation of nitric oxide synthetase. And this is perhaps the major mechanism of how you are lowering IOP with meditation, because nitric oxide dilates the trabecular meshwork and increases aqueous humor outflow. And in fact, you have this drug, latanoprost bunoid, which is a coupling of nitric oxide with latanoprost. So meditation works by causing an increase in levels of nitric oxide, which leads to the increased trabecular outflow. And finally, what about the caregiver? You have a blind patient coming to the OPD with his daughter. So you should understand that the caregivers of glaucoma patient also have a lot of anxiety and depression. This is the first study we reported from RP Center about the caregiver burden in patients of glaucoma. And so we should also target the caregiver, and with meditation, you can have improvement in the anxiety and stress of the caregivers of glaucoma patients. So you have billions of dollars spent on research for glaucoma, but Mother Nature has put in us an inner precious pharmacy. And this is the article, the AIOS email has this article for all of you, meditation as a polypill for the comprehensive management of glaucoma patients. So just by one intervention, you can reduce the intraocular pressure, you can increase the ocular and cerebral blood flow, you can reverse autonomic dysfunction, reduce oxidative stress and inflammation, lead to increase in brain-derived neurotrophic factors, positively impact the quality of life, and also impact the systemic disease the patient may be having and improve the quality of his caregiver. So my take-home message is that treat the patient as well as treat the target IOP. So you have to treat not only the intraocular pressure, but consider the patient as a target and treat the eye as well as the patient behind the eye. And as all of us get closer to meeting our maker, this is a very nice question asked to Lord Buddha. So he was asked that, what have you gained from meditation? And he replied, nothing. However, let me tell you what I lost: anger, anxiety, depression, insecurity, fear of old age and death. Thank you very much.
Thank you, Tanuj. I think that was an excellent presentation. And you were right. People will find it hard to understand. And so that article is very apt, which we have circulated. And now there are more questions on meditation and less on glaucoma. So can you repeat once more how 365 has to be done?
Meditation, focusing the mind, you have to silence the mind, and that is not an easy process. So the easiest way to do meditation is to close your eyes and focus on the breath. So the 365 method is reported in Scientific American, that is 3 times in the day, you reduce your breathing rate to less than 6 breaths per minute for 5 minutes. That induces a state of relaxation. It upregulates the parasympathetic nervous system and downregulates the sympathetic nervous system. And with that, you can have a regulation of the autonomic nervous system, and that state of vasospasm can be dealt with, which is causing ischemia to the optic nerve head.
Dr. Tanuj, there's a question which says that if you are running a study, how do you control the meditation? How do you quantify or control the meditation? So whether a patient is actually meditating, how much he is meditating, how do you quantify that?
So that can be quantified. You have a special apparatus. It is known as the EEG cap. So if the patient is doing this trial, he has to wear an EEG cap. And with the EEG, you can monitor the brain waves and you can make out whether the patient has reached a state of meditation. That is the objective method to quantitate meditation.
Mm-hmm.